Now with diabetes is defined as diabetes because once you get a hemoglobin A1C above 6.5%, the glucose sticks to organs in the body like the kidney and the eyes, and you get eye disease and kidney disease. But before you get diabetes, there's another problem that starts off, which is cardiovascular disease. That starts not at 6.5, but at 5.5. And how severe your diabetes is determines how long your LDL hangs around. So if you've got mild pre-diabetes, which is slightly elevated LDL, the LDL will hang around a little bit longer. If you've got severe diabetes with markedly elevated triglycerides, you'll have LDL that lasts even longer and becomes even smaller and denser because of the triglyceride. So here's a 57-year-old woman, diabetic. She went off her statin because she was having success with her triglycerides. Diabetes is very poorly controlled. When she was on the statin, she had a low level of small dense particles. She went off the statin with a high triglyceride level. She's got a very, very high level of small dense particles. So unless you could control your triglycerides and prevent the small dense LDL forming, you better be on a statin because that's the only thing that can lower small dense LDL other than your diet. So here's another graph of the levels of small dense LDL correlate with the triglyceride level, and these levels are very low. A lot of doctors think triglycerides of 2 or 3 are okay. They're terrible. It should be under 1.5 or ideally under 1. What about chronic kidney disease is another thing that is associated with heart disease. So people with even mild chronic kidney disease have twice the rate of heart disease. Why is that? Well, LDL clearance is slower in kidney disease. It hangs around, and if there's triglycerides present, it becomes small and dense. The likelihood of having small dense LDL in kidney disease is 50-50. Half the patients with kidney disease have small dense LDL. So the presence of renal failure results in additional resistance and higher triglyceride levels. And that's how kidney disease affects things. Many years ago, this is 20 years ago, we were looking at patients with hormonal problems. They seem to have heart disease, they seem to have insulin resistance, and they have small dense LDL. And that small dense LDL in hormonal problems is related to insulin resistance and hypertriglyceridemia. And the last one that I'll mention here is a woman with thyroid disease. An underactive thyroid causes high cholesterol and heart disease. How does it do that? So here's a woman who was on replacement. Her cholesterol was high. The replacement wasn't too bad, but then she increased her thyroid hormone and she was slightly over-replaced. Did these changes in her hormone status have any effect on her particles? Yes, as soon as she increased the thyroid hormone, the small dense LDL disappeared.